Hello everybody, this video is on the IHC marker Gata3. Gata3 is a Gata binding protein. It's a zinc finger transcription factor. It is essential for cell differentiation. It controls the gene expression that is necessary for development of various tissues including T lymphocytes, your breast epithelium and your urothelium. IHC staining pattern is the classical nuclear staining pattern. So where do we use it? So the primary diagnostic utility of Gata3 comes in, it's a very useful marker when we are dealing with carcinoma of unknown primary, like markers such as synapsin and TTF which are used for lung. You can use Gata3 as a primary or first line marker for your breast malignancies and urothelial malignancies. It is common and it is used as a key differentiating factor in differentiating breast and urothelial malignancies from other malignancies which are Gata negative, such as lung, gastrointestinal system and your prostatic adenocarcinomas. So what is its role in breast cancers? So we all know that Gata3 is expressed in more than 90% of the primary and metastatic breast cancers. It is commonly positive or almost 100% positive in ER and PR positive cases. So we can understand that there's a crucial component in the ER signaling pathway. So triple negative cancers are ER, PR and HER2 negative cancers. So in these cancers, the positivity rate is much lower. So seen in less than 25% of the cases. So how about urothelial carcinoma? So we know that Gata3 is expressed in most urothelial cancers. So almost up to 97% of the urothelial cancers express Gata3. It is commonly diffuse positive in your non-muscle invasive or your low grade cancer. So what is its utility here? So here its utility is in identifying urothelial subtyping. However, in high grade tumors, we may see a loss of Gata3. Pitfalls when we use this particular marker. So we can see that Gata3 is not specific or for only those two organs. You may see Gata3 positivity in your renal cell cancers, such as your chromophobe renal cell cancers, basal cell carcinoma of the skin and paraganglioma, and hence you have to use a multi-marker IHC panel when you're coming to a diagnosis in these particular cancers. It has very good diagnostic power in when it comes to Gata3 positive cases such as your breast and urothelial, or using it as a negative marker in GI, prostate and other malignancies. In bladder, it means a higher grade or a muscle invasive or a more aggressive subtype. Therapeutic relevance of this particular marker is as it is associated with ER positivity. So it can be used as a surrogate marker to see the response to endocrine therapy. Thank you.